Well, thank you, the organizers of this, for having me here, and thank you to you guys for showing up. All eight, nine. I know it's a Friday evening, and it's awesome to see you guys here, and I hope you ask questions. Anyway, these are my disclosures. I have a couple of salary positions that are directly related to planetary health, and I do give a lot of free talks. Want to say that, but there's some I get paid for. So those are there, and then I have some research funding from, I guess, your equivalent of the NIH and a local funding thing, which is all to do with planetary health. So I'm putting that all up there. The other thing for you guys to know is that I don't have a background in like environmental anything. I guess the other disclosure, since we're, in a safe space here, is I'm not very smart. So, like if I can do some of this stuff, then I think you like based on averages, if you're really interested in this, should be able to drive an agenda as well. And so, my talk that I was assigned is to just talk about planetary health and strategies for sustainable OR. Now, that was a wonderful first presentation there, and I think you heard a lot about stuff, and I'll try not to kind of repeat everything that was just said. I think that this holds true for the U.S. as well. I just really like this figure, and I think we're facing actually a triple crisis of like climate change, pollution, and loss of biodiversity. Climate change is the one that's kind of most apparent to us, and so when you look at what it intersects with, it really intersects with everything. I mean, this doesn't even have everything on there, but you want to pick your organ system, it intersects with it. Whether it's like changing infectious disease patterns, whether it is increasing cancer rates, whether it's respiratory issues from wildfires, mental health is a big issue. Maybe you don't care about any of that stuff. Maybe you care about social justice, and then you would realize that it's the racialized and lower socioeconomic status communities within the U.S. and within Canada and within most countries that bear the brunt of this. But even if we want to look to low and middle income countries, they are the ones that are kind of paying for our massive carbon footprint that we have had. And so, one thing again, I know I'm already down to about 7 minutes and 45 seconds, just waste a few more with that comment. But one of the things I usually do in my talks is I ask people how they feel about climate change. And when you reflect on that, like, how does it make you feel? When you think about, the changing weather you've seen, and looking out at the audience, a lot of you guys look really young, and I'm probably older than probably everyone in this room, but like, if you have kids or you're thinking about having kids, like, how does it make you feel? And so when I ask this, it's really interesting. No matter the size of the crowd, and whether it's residents, whether it's a department of pediatrics or pathology, or healthcare professionals like pharmacy, I get these very kind of similar answers. This is what it looks like. This is eco anxiety. Why do I bring this up? Like, if you look at this, I plugged in the main words into ChatGPT just to make sure it did reflect anxiety, and ChatGPT said this demonstrated anxiety. So, why do I bring this up? Well, I think a lot of us feel this actually, and although this is like not good for our mental health, this is something that you can exploit, and exploit in the way that one of the main antidotes to eco-anxiety is eco-action. And so, as you think about stuff that you want to do, realize that you're not by yourself, and there's a lot of people out there that actually have these same feelings and want to do things. And so, I mean, you've probably seen this already. Like, why do they want to do things, and why in health should we do things? Well, you take healthcare as a country, it's the fifth biggest country in the world in terms of carbon footprint. This is an American conference. There you go. In terms of per capita carbon footprint, USA is way ahead. This is specific to healthcare. And, if you're higher up on that y-axis, it means there's longer lifespan. So the US is number one in the world, or I guess worst in the world, in terms of its carbon footprint per capita in healthcare, but it doesn't do so at like producing some incredible outcome. And I mean, I'm from Canada, and second worst is actually Canada. So, except we have a higher lifespan. But there's a lot of work to do. There's an impetus for us to do stuff. And I mean, we all kind of went into healthcare to like help, and it seems when you look at some of this stuff that maybe we're not doing that. So the question is, in this really daunting and massive area, how do you move it forward? Now, there's a lot of ways to move it forward. I have a background in quality improvement and patient safety, but quality improvement and patient safety infrastructure exists in almost every hospital and every department, which is why I kind of harp on this a lot. And I think it's something we can take advantage of. And it's really easy to understand because, so if you haven't done QI, the traditional kind of, again, fraction is patient outcome or population outcome over economic cost. So if you improve an outcome and you decrease cost, you get a bigger fraction. That's quality improvement. Like, congratulations. And so, but there was this, again, a Harvard Business Review article which talked about this triple bottom line, which said, hey, maybe it's not all about the money. Maybe there's other things that matter, like social accountability, environmental impact. And so the so-called triple bottom line was born, and we heard about the NHS in the last talk. And guess what? They've been doing this for a decade, and it's been working really well. So we don't need to reinvent the wheel here. We've got the infrastructure. Let's use it, and you can harness this to do all sorts of cool things. So again, you can look at kind of what you do, but I just want to give you some very simple ideas. And I think as you think about your ideas, you should write about them and share that story, because I think you don't want to start on micro level, person to person, meso level, organization. But what we really need is transformative change, because we really are facing an existential crisis and we need transformative change. And this decade actually really matters. And so this is something that like seems really simple. But this is from a community hospital in Ontario. They started with this thing where like patients come in, and when for surgery or endoscopy, they're given plastic bags to put their clothing into and their shoes into. That's a lot of plastic bags. When you do the math and the carbon footprint, it's massive. And so they just changed the instructions to tell people to bring in their own bags. Guess what? 90% reduction in plastic bags. And now they're telling them to bring in their own cups too. So they've done their bring your own reusable bag and bring your own reusable cups. And like, I think we could talk to our table here and say, hey, maybe you should bring your own reusable cups instead of using bottled water. But hey, that's how to like disengage from your whole panel. So, and then, the other thing is, you probably heard about desflurane. It has 2,500 times the warming capacity of carbon dioxide. This is again a QI thing, but like the big thing that drove it down, the presentation there that drove it down, that was done by a resident. And like this is like an old slide now. Like now it's basically dropped to nothing. And so this was at our institution, really powerful. Didn't need to be someone way up in the hierarchy. And the other thing, again, if I go back to the Harvard Business Review, they've written articles on change in healthcare. Like it doesn't matter where you are in the hierarchy. In fact, it's found that if you just have a good network, that's what drives change. And if you don't have that, then talk to someone who does, and you can drive change. And so this is another really cool thing, is just optimizing surgical instrument tray. We don't use a lot of our instruments. If you were at the talk this morning by Andrew McNeil, it's like in this thing, what they found was that about 50% instruments don't get used. It's not just like it's a waste of water and washing, but guess what? Instruments get really damaged while they go down to the SPD to get cleaned as well. So again, and this actually, there's an internist who's actually doing this for thoracentesis and paracentesis at our institution very successfully, and found the same thing. Like 50% of the stuff that people are opening doesn't get used. So this was pretty cool. And then finally, like talking about hierarchy, I showed this, like Niamh Seguin, it was a medical student who did a leadership elective with me in Planetary Health. So when she had been in a different hospital where they use kind of reusable gowns, and you heard about the reusable gown kind of data, so I don't need to go over that again. So again, I kind of connected her with procurement and stuff like that. We're like a reasonable sized hospital in Ottawa, believe it or not. I know from Canada, you think everything's probably small, but no, like we're like a greater than 1,000 bed hospital, using 283,000 disposable gowns per year. So Niamh spent her 1 month. She looked at the data, found that study that you saw in the last presentation, worked with an MBA person, found that we save $135,000 a year. And a lot of green care is actually cost saving. And guess what? The Ottawa Hospital is switching over to reusable gowns. That's pretty cool. She was a medical student. And not only that, The reason why I showed you these particular ideas today is that in Ontario, we have this quality improvement network. And it has 45 hospitals, does over 70% of the surgery in Ontario. That's a population of about 16 or 17 million people. We pick themes every year. And when I became director of Planetary Health, I went and talked to them and I was like, hey, you know what? Why don't we do Planetary Health? And so like cut the carbon is what happened. And we gave 5 change ideas, and the 5 that I just talked to you about were the ones that were used. And Niev's slide presentation, which he used to kind of convince the administration at our hospital, was given to the 45 hospitals in Ontario. So you talk about kind of micro, meso, macro change. You know, you can do transformative stuff in this space because there's not a lot of people doing it. It's evidenced by the fact that we have 9 people in this audience. So, I know I'm over time, but this morning I didn't get to call out the God of my OR, and now you guys are getting scared because I'm going into religion. But I have one God in my OR. His name is Drake. For those of you who don't know Drake, Drake is best hip hop artist ever. Anyway, Drake finishes all his concerts by saying the same thing, and I can't say what he says, but I decided to emulate Drake, and I like to finish all my presentations by saying the same thing too. And I really like philosophy, so I quote modern Canadian philosopher Michael McLuhan, and he says, "On Spaceship Earth, there are no passengers. We are all crew." And I think we're really important crew, so I hope you take this on. Thank you.